Hello everyone, this is Dr. Omar Shakori with you, and today we will explain the first class for clinical OSCE examination for AMC Clinical Exam. As most of you know, you have to pass AMC MCQ exam before going to do clinical AMC exam. The AMC Clinical Exam consists of 16 OSCE stations, which can be passed if you focus on the main things in any clinical OSCE examination. You are welcome to join our academy in soma.org.uk and register a free account to stay updated in our clinical courses and MCQ courses for AMC exam. And I will put the link for direct clinical OSCE exam course, the full course, and you are welcome to join us. Let's see what we will learn in this first class. We will be in the first lecture, you will know the type of clinical OSCE stations in the exam, and you will know the checklist, the essential one for a clinical exam, and you will have a logical approach for a stable patient, and you will have a management plan for all patients, and you will have an investigation approach for any patient, and you will have some presentation skills during your presentations, and you will have answering technique. I will teach you answering technique for any OSCE exam. So any station, you will know how to deal with it, even if you don't have enough information for responding to the examiner. So, what are the types of station in any clinical exam? Type of stations here, we have 6 types of station. The first type is history taking, other is about communication skills, and other about patient examination and procedure or practical skills, or data and investigation interpretation, reading and analysis and discussion. Or you have some combined station like history and examination. So these are the types of any OSCE stations. You have to know you are in which station. You are in history taking or you are in communication, so you can focus your answering about the main topic in this station. Now, essential checklist. This is a very important thing you have to know during your exam. The mnemonic Windsor, don't forget this. The W for washing hand, I for introduce yourself, N for notice, C for consent, E for expose, and R for reposition. Look, this is a very important and critical in any station. During the OSCE exam, you have to do those. You have to dress appropriately, you have to wear name badge, you have to wash your hand in front of the examiner and patient. Use alcohol hand rub, I prefer this. So you can bring alcohol hand rub during your exam and dress appropriately and wear the name badge. Also, you have to introduce yourself to examiner and patient, not only the patient, not only the examiner, for both. You have to be noticed, you have to be observant. Once you enter a station for OSCE, look around, look to the patient, look to the surrounding of patient, look to the examiner, look to the surrounding of the examiner. Also, you have to ask for consent. Ask for consent from the patient and from the examiner. Like this, ask about the presence. Ask the patient if you like me, if you accept me to examine, if you accept me to take history from you. ask about the presence of pain, and ensure that your patient is comfort. Expose, you have to develop a rapport and treat patient with respect. So you have to give respect and you have to expose. Be exposed mean explain your actions to the patient while you are examining the patient. Reposition, always remember to stay your position in the right side of patient, right side or right hand of patient during station and during examination, and always thank the patient and the examiner on completing your examination. This is example of the main important checklist. Hello, as the doctor said, hello, my name is James. I have been asked to examine your heart. Do you have any pain anywhere? I may talk. This is the consent. I may talk about you to the examiner as I go along. I will also need to uncover your chest to listen to your heart. Is that is okay? If that is okay, so the patient will give you his impression. So this is taking consent and doing introduction. The doctor introduce himself to the patient and taking the consent. This is a very important and very crucial in all OSCE stations. All OSCE stations, you have to introduce yourself to the patient, to the examiner, and taking consent from the patient, and be polite and also be clear with the patient. Remember the elements of essential checklist. Those elements are for all OSCE stations. Missing these will lead to loss of easy marks. You will lose the easy marks for them. As you know, doctors, for all patients, for all stable or patient, we have to do the following approach. We will take the history first, and then we will do the examination, and then we will give summarization for history and examination, and we will put differential diagnosis, and then we will list the problems of the patient, and then we will go for management plan, which include investigation and so on in the next slide. So again, we will do for a stable patient, a stable OSCE station. Patient is stable, it is not a critical. Patient is not a critical in OSCE. The patient, we will have some history, some examination, summarizing our thoughts and differential diagnosis, problem list, and we will go later for management plan. As a management plan in all medical patient or surgical patient, the management consists of those things. We will start with investigation, and we will see the allogram later, and then we will give some treatment, which is medical or surgical, and we will do some procedures like cannula, like drain, like catheter, lumbar puncture, fluid aspirate, whatever, and we will decide where to put the patient. We will put the patient in intensive care or coronary care, heart care, general ward or specialist ward, and also we will monitor the patient. This is also part of management of patient. And we will also decide to do multidisciplinary team or asking for consultation of other branches like I am GP, general practitioner, or I am emergency physician. I will ask for general surgery idea or general medicine idea about the patient condition, like a specialist review, doctor or nurse, and patient education. All of these are part of management plan for any medical patient. So we will start investigation, treatment, procedure, location where to put the patient, monitoring, multidisciplinary team, and specialist review and patient education, starting from support group, starting from patient leaflet, specialist opinion, or clear explanation. In general, in OSCE examination, remember that the investigation are like this. There are some specialist investigation, and we will explain them here below, and there are simple investigation. The simple investigation for all medical and surgical patients start from blood test, imaging, microbiology, and ECG. Those are the simple investigation. Blood tests like hematology, clinical chemistry, like immunology, like microbiology, and arterial blood gas. For example, hematology, full blood count, coagulation study, culture sensitivity, cross-match, clinical biochemistry like liver function test, renal function test, glucose, calcium, troponin, etc. Immunology like autoimmune, IgS, IgG, IgM, whatever. Microbiology like hepatitis screen, hepatitis serology. So remember the main idea. This is the main investigation in any problem. The simple one, like imaging, we start with we start with the plain X-rays, ultrasound, CT, MRI, echocardiogram, and nuclear medicine. For microbiology, we will have urine for microbiology, and urine analysis, blood analysis, sputum analysis, stool analysis, swab analysis, and CSF and pleural or ascitic aspirate, and ECG. While specialist investigation like in cardiology, we may need angiogram. In respiratory, bronchoscopy. In gastrointestinal, GIT, we may need OGD, duodenoscopy, or colonoscope, like nerve conduction study in neurology, and general surgery, laparoscope, and vascular surgery, angiography. For renal biopsy may need. Dermatology, we may need skin biopsy. So this slide contains all investigation you need to know. If you know nothing about the station, you have to know the investigation, the rule of investigation. You can start with saying, I will send for the simple investigations like a blood test, like imaging, like microbiology, and so on. You can just enumerate some of them. Now, after you took the history and you did examination and you sent the patient for investigation, and now it's time for presentation in the OSCE. The presentation has its own skills. You have to maintain eye contact with the examiner, avoid staring. This is very important. Avoid staring to at the patient when presenting for examiner. Also, I prefer that you clasp hands behind your back to prevent fiddling. You have to speak clearly. You have to prepare your opening sentences. This is very important. You have to prepare your opening sentence in your head so as to start in a confident manner. This is the first impression that you give to the examiner. So the opening sentence must be presented with confidence, and this is very important. Some examples in history stations, I prefer that you remember this. To say Mrs. X is a 56-year-old woman who works as a receptionist and presented with blah 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 blah, and you continue the history. So this is how to start. In examination station, you have to start like this. On examination, Mr. X is comfortable with no signs in the hands of cardiovascular disease. His pulse is, and you continue the presentation of your examination. Another example is a cases a causes. The examiner asks you about causes. I prefer once you will be asked about causes, you say like this: the causes of X. Let's take example pleural effusion. The causes of pleural effusion can be classified into transudate and exudate. The causes and you will continue. Transudate examples like blah blah blah. Transudate examples like blah blah blah. The causes of mitral regurgitation include like this. Other presentation skills. Structure your finding logically. Do not waffle. Present positive finding. This is very important. And relative, you have to, in OSCE, it is not long history. It's 10 minutes station. It is 10 minutes station. So you have in 10 minutes, you have to continue to complete all the needed information, starting from saying hi to the patient, introduce yourself, then taking some history, discuss with the examiner, give explanation, and answering what is needed from you. So remember, during the presentation, you have to present the positive finding and relevant negative ones. For example, no weight loss would be important negative finding in a patient with dysphagia. This is very important. If you have a patient with dysphagia, for example, you have to mention if this patient has weight loss or no weight loss. So this is important because the patient has GIT problem. Also try to present your differential diagnosis and the problem list as a continuation of your finding rather than waiting to be promoted. For example, look, I prefer that once you present the history like this, I have, let's say, Mr. X has a cough for 3 days duration associated with fever, and he does not respond to analgesic and antipyretic. On examination, the patient has a bilateral basal lung crepitation. If I stopped like this and I finish the presentation for history and examination, the doctor usually will ask me about what do you think is the cause. In this trick, I prefer that you start saying the causes before the examiner told you give me some causes. So once you finish like this, once I finish, my patient has cough, fever, 3 days, not responding to treatment, not responding to antipyretic and analgesia, and on examination bilateral lung crepitation, I am thinking about, I will continue like this. I have a differential diagnosis for this patient. I will say to my examiner, there are many causes cause this, starting from cardiovascular causes and respiratory causes. Some of cardiovascular causes like patient with heart failure, and some of respiratory causes like patient with pneumonia. So I guided my examiner to my knowledge. I didn't let the examiner ask me a direct question. So once you give this, you will guide your examiner, not he will guide you. Okay? So that's the idea. Try to present your differential diagnosis and the problem list as a continuation of your finding rather than waiting for examiner. Although in common usage, try to avoid abbreviation during exam like MI. Once you say MI, all of us, all doctors, even examiner know that it is my MI, it is myocardial infarction. But during OSCE exam, you have not to say this patient has a mitral MI. You have to say, this is myocardial infarction. Do not use abbreviation. Also, do not be afraid of silence to collect your thoughts. It is better to think through an answer before rushing to wrong conclusion. I prefer that you think about your answer before rushing wrong conclusion. If you begin to start digging a hole, try to stop, apologize, and ask to collect your thoughts and start again if this is allowed in the exam. But this is usually time is not enough to go like this. Never use the term cancer. This is very important and a fatal mistake trick. Never use term cancer or malignancy during discussion differential diagnosis in the presence of patient. You must never say a term of cancer or malignancy in front of patient, even if you are discussing this with your colleague or with the examiner. This is a big mistake. This will lead to you fail in the exam. Now, some techniques about OSCE clinical exam. Techniques does play a role play a part in passing OSCE. Make sure that you have plenty of practice in presenting patient. You have to have plenty of practice. OSCE make you practicing more and more to pass easy. Before exam day, when asked the questions, when you ask, try to present the answers in logical order. I mean by this, try to present in logical better than saying the first answer in your mind. So just think for a few seconds and then give the answer. The examiner want to know that you are a safe clinician, a safe doctor, but you should be able to initially offer some sensible discussion. This is the main of all OSCE stations. All examiners want to be sure that you are a safe doctor and you have some clinical sensible discussion. Possible questions during OSCE examination. Sometimes they will ask you about etiology, pathophysiology, symptom, sign, common investigation, specialist investigation, poor prognostic features for a specific disease, treatment options, management, and complication. Those are the most likely to be asked during discussion of any clinical OSCE. We are continuing our answering technique. Look, keep to logical structure. Start abroad. This is a very important. You have to start abroad and then be more specific. As I said previously, a patient with cough, once I present the causes, I told my examiner that I think there are many differential diagnoses for patient condition with basal lung crepitations, bilateral basal chest crepitations. I told my examiner that patient may have cardiovascular causes or respiratory causes, I started abroad and then become more specific. So I said after that, some cardiac causes like heart failure, and some of respiratory causes like pneumonia. The same here, you have to start abroad and become more specific. Like when we said the causes of pleural effusion can be initially divided into exudate and transudate, and exudates includes, and so on. Use some form of classification in your answer rather than giving enumerated answers, like causes of basal crepitation is pneumonia, heart failure. No, I don't want you to do it like this. Do it broad and then go specific, more specific. Do some classification. The best method to use for classification is a mnemonic, which is vitamins C, D, E, F, G, and H. And we will see this next few slides. This mnemonic is used to classify any causes of any disease in the body. Now some examples of presentation. Like when we say the causes of X can be classified into cardiovascular, respiratory, and endocrine. For example, the causes of atrial fibrillation can be divided into cardiovascular, such as valvular disease and hypertensive heart disease and ischemic heart disease, and can be classified into infective, cardiovascular, and infective like pneumonia, and also endocrine causes such as blah 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 and so on. The causes of Y can be classified into vascular, infective, and neoplastic. Other example, the causes of diarrhea can be divided into vascular, infective, neoplastic, drugs, inflammatory, etc. For example, for vascular, ischemic bowel disease can cause diarrhea. Infective, like viral infection, bacterial infection, can cause diarrhea. Neoplastic, like colonic cancer, can cause diarrhea. Inflammatory, like ulcerative colitis, can cause diarrhea. Drugs, like the laxative, can cause diarrhea. Another examples, treatment can be divided, start abroad, then go specific. Treatment can be divided into medical, surgical, multidisciplinary. For example, treatment of rheumatoid arthritis can be divided into medical, like simple analgesia and anti-inflammatory medications and disease-modifying drugs, or surgical, like joint fusion or joint replacement, or multidisciplinary team like physio and occupational therapy. Treatment also can be divided into acute, subacute, or chronic, early or late. Post-operative complication can be divided into early and late. Remember to give example for each category. If you unsure of etiology of the diagnosis, remember the mnemonic vitamins C, D, E, F, G, H. So this is a very important mnemonic. As you see here, the vitamins C, D, E, F, G, H. Start the causes in general are vascular, inflammatory, traumatic, autoimmune, metabolic, idiopathic or iatrogenic, neoplastic, substance abuse, congenital, dysplastic, endocrine, functional, genetic, and hysterical causes. This is vitamin C, D, E, F, G, H. Thank you for watching the first class of our course for AMC Clinical OSCE examination. Our next class will be how to take a proper history and to pass any history stations, to start from abroad, and then we will go for surgery, medicine, and gynae and pediatric history and examination, and so on. We will cover all OSCE stations inshallah, and we will give some recalls. So please, if you are interested, you can contact me on this number, and if you have any question, you can also contact me in this number. If you're still not enrolled in our academy for all our new courses, you can go and sign up a free account to receive all our free courses and promotional courses for medical study. Thanks for watching this. See you in the next class.